So during birth, your vagina will stretch to allow your baby to be born, and your vaginal muscles are perfectly designed to do this. And slowing down the birth of your baby's head can just allow time for those muscles to stretch. Many women will experience a tear or a graze to their vulva, which is the outer part, often referred to as the vagina, but it is the vulva. Or they may experience a tear to the muscles inside the vagina. You will be offered a vaginal examination from your midwife after the birth of your baby, just to determine if you have any tears, and they will discuss suturing at that time with you as well. So this video will briefly describe the vaginal examination after birth and the suturing process. So once you've consented to the vaginal examination, your midwife will collect some equipment, and they will ask you to part your legs so they can examine your vulva and vagina. If you are feeling any pain at this time, you can request pain relief, and usually Entonox, known as gas and air, is quite good at this time. So first the midwife will put on some sterile gloves, and they may need to shine a light in between your legs so that they can see properly. They will start the examination by washing your vulva and vagina with some warm water and cotton wool, and this is so that they can see properly. So once your vulva has been cleaned, the midwife may touch you with the gloves on, and they will look at the vulva first and see if there's any grazes or tears. If you want them to explain and talk to you during this examination, they can, or you can ask them to tell you everything at the end. Tears and grazes that involve the skin only are often referred to as a first-degree tear, and often these don't need suturing unless they're bleeding. So a tear that involves the skin and the muscles in the vagina is often referred to as a second-degree tear, and these often need suturing, especially if they're bleeding. So the midwife will be touching you at this time. Like I say, use pain relief if you need to, but if you can ask them to stop at any time, and they will. Once this vaginal examination is completed, the midwife will then ask for your consent to perform a rectal examination. And this will involve the midwife inserting one finger into your bottom and one finger into your vagina. And this is to feel if there's any extended tears, or if there's any tears that go through the vaginal wall and into the rectum. This is a really important examination because these tears can affect the anal sphincter around your bottom and can lead to incontinence if they're not repaired. If you do have any tears, the midwife will discuss this at the time with you and will recommend a course of treatment. So a first-degree tear often doesn't need suturing. A second-degree tear often will need suturing, and that can be repaired by the midwife in the room. But a third or fourth degree tear will need repairing in theatre by a consultant, and this is really important for your future health. If you do have a second degree tear, the midwife will then gather some equipment, and she will get pain relief, which is called lidocaine. This is injected into the vaginal muscles, and it will make the area go numb. If you do start to feel any sensations during the suturing process, or if you start to feel pain, then ask your midwife to stop, and they will provide more pain relief, or they will inject some more lidocaine and wait until it's numb again. Your legs might need to be wide apart, and sometimes they may need to be put into a lithotomy position, and this means that your legs might be raised up onto poles at the side of the bed. This will enable the midwife to be able to suture your vaginal muscles properly. So the midwife will use a small circular needle to bring the tear together, and a special thread which dissolves within a few weeks after the repair. And following the repair, the midwife will do another vaginal examination where they will look at the vaginal muscles and make sure that bleeding has stopped. They will also perform another rectal examination, and they may ask you to clench your bottom together, and this is to check that none of the sutures have gone through. You may then be offered rectal pain relief called diclofenac, which is an anti-inflammatory tablet that goes into your bottom. It's a suppository, and that gives pain relief right at the area where it's needed. So when you've had your stitches, the area will be sore and painful. So there's a few things that you can do to ease this pain. Some women find using putting sanitary towels in the freezer to make them cold. Sometimes women find that comforting, but make sure they're not frozen because this can stick to your skin. Some women find having warm baths comforting. You can definitely take paracetamol and ibuprofen if you're not allergic to that. When you first open your bowels after having a baby, it can be really painful. So by using a cotton pad or a clean sanitary towel and just holding that against your perineum and against where the stitches are can mean that you can control your bowel movement a little bit better. You will be asked to report to your local maternity unit if the area where you've had your stitches is more painful, or if you have a discharge that smells different, or if you develop a temperature that's over 37.5, or you feel unwell. These may be signs of infection, and you may need some antibiotics. It's also important to start doing pelvic floor exercises as soon as possible. This will help the muscles repair and get back to normal.